I'm Dr. Jim Kiley, and I bring you greetings from the National Heart, Lung, and Blood Institute at the National Institutes of Health, where I serve as the Director of the Division of Lung Diseases. NHLBI and AARC have been partners for more than 2 decades through our National Asthma Education and Prevention Programs Coordinating Committee. We now have an opportunity to work together on another common critical respiratory disease, chronic obstructive pulmonary disease, or COPD. 2017 COPD National Action Plan is an unprecedented initiative spearheaded by the NHLBI that will coordinate the many different groups and organizations to make a real difference in the lives of those who suffer from COPD. Respiratory therapists and the AARC are critical for this initiative for the vital roles you play in the diagnosis, treatment, and management of COPD. I appreciate this opportunity to share a bit about the COPD National Action Plan with you. It's an exciting and ambitious effort, and I hope each of you will want to join and make it a success.
COPD is a crippling lung disease that with time takes away your capability of breathing.
About 1 in 5 individuals have COPD, but there are millions more that may have the disease and they don't even know it.
COPD is the 3rd leading cause of death in this country, but is also the 4th leading cause of disability.
Primarily, this is a condition that affects older individuals, usually age 45 and above, and more women are affected by COPD, and more women are dying from COPD than men.
While COPD was thought to be a disease of smokers, either current smokers or ex-smokers, recent data are showing us that up to a quarter of people with COPD have never smoked. Among the 6 major killer diseases in the United States, COPD is the only one where deaths are not declining. The public prompted Congress to ask NIH to start doing something about it. Because of that, more than 2 years ago, we started working with both federal and non-federal collaborators, patients of course and their families, patient representatives, healthcare providers, trying to get together and come up with some practical way to get around this horrible disease.
So the National Action Plan for COPD has 5 goals. This action plan is the first ever plan to address COPD. The plan was conceived, developed, designed by all of the stakeholders, all of the organizations out there that care about COPD. Everyone owns this plan, and because they all own it, we think we will see action over the next 5 years or so.
Now that we have a plan, we can't consider something that goes on the shelf. It's not something that is going to be a dust collector.
We think it's important that we do this in a coordinated way so that we do have each stakeholder taking on an element of this plan.
Only if this works as a unit, it will deliver what we expect. That means trying to curb the disease in terms of mortality and morbidity.
Success of the COPD Action Plan requires that everyone take a role in implementing the plan, and to learn more about the plan, we urge everyone to go to the website. As you can see, the COPD National Action Plan is a blueprint for all stakeholders to contribute to the COPD cause. We're grateful that AARC participated in the discussions and provided input that made the plan the comprehensive document it is today. As you consider how the association might implement the plan, or you as a respiratory therapist might contribute, here are some ideas. In its introduction, the plan highlights the importance of pulmonary rehabilitation as a therapeutic intervention. Under Goal 2, the plan underscores the role of respiratory therapists as patient-centric COPD management. Together with other providers, respiratory therapists should help create, validate, and implement best practices that speak to when and how to use oxygen in physical therapy and what a patient should expect from optimal therapy. Under Goal 3, the plan notes another way AARC can contribute by assisting with the assessment of pulmonary rehabilitation services. That means helping determine how available they are and how they can be used. AARC can also help by monitoring the delivery and impact of COPD care and treatment. Under Goal 4, AARC can play a key role in helping with research. This includes studies that address barriers to care and that identify the components of the most effective pulmonary rehabilitation programs. Such studies can also identify better ways to provide services in rural areas. Finally, under Goal 5, AARC as an advocate for patients can contribute to the development and implementation of COPD quality measures that ultimately get incorporated into national care delivery. So there you have it, AARC. You as individuals, as an organization, are a fundamental part of the all who own the COPD National Action Plan. We look forward to continuing to work together as we implement this plan.